Hey guys, we are back to talk with Dr. Emily Pace. She is a physical therapist specializing in pelvic floor therapy. She works currently at East Tennessee Spine and Sport, and she also has started her own business for physical therapy information called Pace Yourself. So we're going to talk about that towards the end, but right now we're going to talk about a couple of updated things from our last video as far as pelvic floor therapy, what it is, how it can benefit, and just get some extra knowledge from Dr. Pace today. So thank you for talking to me again.
Thank you for having me on.
Of course.
So fun.
You are so sweet and so knowledgeable.
Oh, thank you.
So let's just talk about pelvic floor therapy. So who is it for? Who can benefit from it? Mm-hmm. Let's jump in there.
Yeah, so pelvic floor therapy is really for everybody. Everybody has a pelvic floor, man, woman, child, and there's definitely reasons why you'd go see a pelvic floor therapist. So I know we talked last time about the anatomy, and I always have my handy dandy pelvis to go over that again, because most people don't walk around with a working anatomy of their pelvic floor. Most people don't even know they have a pelvic floor, unless you're having problems or you're friends with the pelvic floor therapist, in which case you get spammed all the time about pelvic floor stuff.
It's good spam though.
Always good spam. So here's your pelvis, right? Lives way down in your body at the very bottom. So if we flip this up, we're looking from the bottom end. There's the vagina, there's the rectum, and then you probably can't see it as well, but the urethra is right on top there. So those are all the holes kind of in the bottom. This is a female pelvis. If we tip it forward, you can see the organs. We've got rectum, uterus, bladder. And so basically your pelvic floor has 5 jobs. Your pelvic floor is there to support all your organs, help to stabilize your pelvis as a whole, help with sphincter function, so meaning keeping bowel or urine and stool in the bowel and bladder until it's time to go to the bathroom, and then it should relax and allow all that to come out. And then it also assists in sexual function, both in men and women, and it helps to push extra fluid from down in the lower pelvis area up into the abdominal area, so it can be reabsorbed and taken care of.
Oh, wow. Okay.
So a lot of functions in just these little tiny muscles.
Wow.
And they work together with your hips, they work together with your lumbar spine and your SI joint, and they basically help to be the bottom of your core.
Wow. So. It's amazing how all those things are so delicate and intricate in their workings. Mm-hmm. And lots of times I always tell clients, like, if you have an issue in your back or your hip, it could be stemming from something that's necessarily not in your back or hip.
Absolutely.
Stemming from it.
Absolutely. And pelvic floor is unique in that it can refer to a lot of different places. Like, yes, you may feel some back pain and maybe you've had it addressed by somebody else, but nobody's looked at your pelvic floor. And also maybe you have some urinary incontinence, a little bit of pain with intercourse, and kind of throw all those things together. And my brain goes, oh, pelvic floor is probably involved. Okay. So let's assess from the outside first, and if then we're not making progress, and let's look at those muscles and see what role they're playing in that issue as well.
Okay, that's awesome. Mm-hmm. So good to know. So in our first video, we talked about a lot of the common issues with pelvic floor and things that you see a lot. So leaking during, if you sneeze, things like that. So let's talk about some that maybe aren't quite as, like you said, where you would think like, oh, this is something that's stemming from my pelvic area. What's some other common issues that you see that might stem from that area?
So tailbone injuries. A lot of people think, oh, it's my tailbone, there's nothing that I can do about it. Pelvic floor therapists, those of us who are trained, we can assess the tailbone itself. We can do that vaginally, we can do that rectally, we can do that externally, and we can mobilize it and mobilize the tissues around it so that the tailbone doesn't give you the pain, especially with sitting, or if you do yoga classes and you have to weight bear on your tailbone.
Painful.
It's so painful.
Yeah.
And most people think they just have to live with it. And they definitely don't.
But I've always heard, and I had a tailbone issue a couple of years ago before I knew you, and it took months for it to feel any better. And I'm on the floor a lot. So that's good to know.
Absolutely.
Any other big ones?
Yeah, pain with intercourse. A lot of people don't even think there's anything that can be done about it. They think it's hormones or just throw a bunch of lubricant at it, and that's not always the best answer. There's a lot of things that we can do to address all of these muscles that are impacted, particularly in women with painful intercourse, but men too. Yeah. Because the pelvic floor in men helps to maintain an erection and helps with ejaculation and orgasm in both men and women. Wow. And so a lot of times when we fix the function of the pelvic floor, sometimes that sexual function, especially orgasm in women and men, improves. That's amazing. So it's a really fun side effect to have.
Yeah, that's awesome. You get to help people just expand their relationships and quality of life, and it's not something that they have to necessarily pop a pill for. You can actually get to the root of the problem.
Absolutely.
That's why I do these things, because I think if you can get to the root and really solve the main issue, and we can do less of all the other things that don't fix them, it's just amazing.
Absolutely.
Okay, awesome. So let's talk about, if someone comes to you for a pelvic floor appointment, what does that, just a general typical first appointment, what's that look like for someone if they are a little bit nervous about this?
Yeah, so the first time, our first job is just to talk, right? I'm going to sit down, I'm going to have a conversation with you. We're going to figure out what's going on. I'm going to listen to how all your symptoms started, try to put together your puzzle pieces, and then we're going to look from the outside first, and then we'll go inside if you want to. We don't always have to. So I usually do a screen of the lumbar spine, which is the low back. I'll look at the pelvis, or the SI joint where the bottom of the spine and pelvis come together. I'll look at the hip joint. I'll look at hip strength, core strength, and then if the patient is comfortable and is okay with it, and I think it's important to do, we'll take a look at the pelvic floor. Sometimes my first couple of visits are just, let's look at your spine, let's address what's going on here, see how much clears up, and then we'll look at your pelvic floor. Because if it's really coming from the spine, or if it's coming from the hip or the SI joint, doesn't matter how much work I do on the pelvic floor, right? It's never going to get better. So we have to find the driver of the problem first, and then work on the symptoms.
Okay.
And then to assess the pelvic floor, we have several options. The most common one that I typically do is I'll have the patient undressed from the waist down, cover up with a sheet in a very private room. Nobody barges in, nobody bothers us. And then I just take a gloved hand and I assess the muscles on the outside first, which we can do the whole assessment totally externally. And then I'll either go through the vagina or through the rectum, depending on where the problem is, and assess what's going on with those muscles in those places.
Okay.
So, some bowel dysfunction, pain with bowel movements, constipation, those are things that we can treat, and those would be reasons to go rectally versus vaginally. Pain with intercourse, urinary problems, I typically will go vaginally. Even sometimes if people aren't comfortable with rectal assessment, and we don't ever have to do it if that's not a comfortable thing for some people,
good to know.
we can do a lot of work vaginally, just because all of that connects in, right? And I can get all the muscles that I need to internally, or even externally, without ever going into the rectum.
Okay, so you have options if you're not comfortable at the first, or the second time, then ever you can have those options if it's not something that you're comfortable with.
Absolutely.
And then if you're doing an internal kind of exam, what is the patient doing? Are you having them bear down? Are you having them squeeze? Or are they just relaxed in that? Are they kind of a participant in that?
It depends.
Okay.
They're always a participant, right? Like, you're always going to be a participant in your treatment.
Okay.
But when I'm doing an internal assessment, it depends on what your symptoms are.
Okay.
So first thing that I usually do is just screen the muscles and make sure there aren't any tight spots in the muscle.
Okay.
So like if you had a neck issue, right, and you're hurting right here and you get a tight spot in your muscle, the same thing can happen here in your pelvic floor. And so if that's the case, even with someone who's not necessarily having pain, but might be having leakage or prolapsy type symptoms, then these muscles can contribute to those symptoms as well.
Wow.
So I want to rule out that those muscles aren't too short and tight first, so that I don't try to strengthen you and then make your symptoms worse.
Sure.
So once we've assessed that the muscles aren't short and tight, or there aren't any trigger points or tight spots in the muscle, then we'll find out, can you contract the muscles? Can you relax the muscles? And then can you lengthen? And lengthen isn't quite a bear down.
Okay.
So I'll do a bear down assessment for prolapse, just to kind of see how much movement there is. So if the organs aren't as well supported, then we can assess. I can't grade or diagnose a prolapse, but what I can always say is, hey, this is something PT can still help with, or hey, let's call your doctor, or like, well, let's get you to a surgeon.
Okay.
So
options.
I always try to give options if I'm not the right fit.
Okay.
But from there, from just doing that assessment, then that helps me give a game plan. Do we need to do some hands-on work and work on the tight muscles first, and then work on strengthening and coordinating them? Or are things good? Can we go straight to strengthening? Is that what you need?
Yeah.
Most of my patients don't need just straight strengthening. I will say that.
Yeah.
Most of the people who can fix like leakage problems on their own, it's because if they're just weak, then they can do some pelvic floor strengthening and some core strengthening and kind of take care of it on their own. Most of the people who get to me, it's a little more complicated than that. Yeah. So every plan for every patient is very individualized.
Love
Now,
that.
it's not to say that you don't see some of my patients doing the same exercises over and over and over again, because there's some basic ones that I like to start with.
Yes.
But depending on what your goals are, how strong you are, how weak you are, then we'll kind of work towards what works for you and what kind of function you want to get back to.
Okay.
So if I've got someone who's a power lifter, your goals are very different than my 80-year-old lady who just wants to be able to walk through the grocery store without peeing on herself.
Yes.
So.
Oh man, I love that you work with such a wide range of clients too, and patients that you see, very young, very old, and like Emily says, different goals. So everybody can benefit from this, and it's leading into my next question: is it ever too late? So
No.
I get that question sometimes, like, I've had this issue for 10 plus years, and how is this going to help me? So let's talk about that.
Absolutely. I would say it's never too late to get an assessment. Now, we may have a conversation of, I can maybe help you with 50% of these issues, or, hey, let's talk to your doctor, and maybe you need, some additional medication or additional support, or maybe surgery is the right option for you. Even if surgery is the right option, pelvic floor therapy helps to fix the function. The surgery is going to fix the anatomy, and we can help make your surgical outcomes better. Most people have knee surgery and go straight to PT, right? We have pelvic surgeries and we don't go to PT.
That's so true.
And the problem that was contributing to why you're having problems before is still there.
Fixed,
They just fix the anatomy. And a lot of times that is really helpful, but if you want long-term surgical outcomes, I see a lot of really good benefit with just even a couple of visits with a therapist who can help you reconnect with the muscles and help with your strategies and make sure that this problem doesn't continue to be a problem down the road.
To know that if you do have to have a surgery, to get the maximum benefit out of it long term.
Absolutely.
To follow it with that PT. So I love that it's never too late, like you said, just to get an assessment and see where things are and how the pelvic floor therapy can help.
And if you have a really good pelvic floor therapist, we're not going to keep treating something that's not working.
Right.
We're not going to bang our heads against the wall and make you bang your head against the wall if things aren't getting better.
I love that. You don't want to waste their time.
No.
Yeah.
Everybody's time is so valuable, and we're all so busy.
Yeah.
And it's just not fair to ask you to do something that's not being helpful.
That's not working. I love that. Finding the solution and not prolonging things.
Absolutely.
So tell us a little bit about Pace Yourself.
Yeah. So, most of you kind of are aware, you didn't know what a pelvic floor was before we started some of this. Yes. So most people have no idea where their pelvic floor is, what it does. And so what I wanted to do is build a program that helps to kind of bridge the gap between what people know and what options are out there. So at the moment, most of Pace Yourself is online education, and it's free material at the moment. But I'm currently working on building, it's called Pace Yourself Postpartum. And basically it's how do you manage your body, how do you manage the musculoskeletal side of postpartum in the first 8 weeks after you have a baby.
Wow. That's
so
awesome.
It's how do you lift and carry your baby? How do you have a proper bowel movement without pain? How do you manage scar tissue? How do you manage after a C-section when you're not supposed to be lifting things, but you have a screaming child, and so sometimes you have to lift and carry.
It's not realistic always.
Exactly.
Yeah.
And then also return to exercise. How do you get back to exercising? Because there are a lot of women who are like, I don't want to do anything for that first 6 weeks. And then you have a lot of women who are like, I want to get back to running tomorrow.
Exactly.
And you've had major trauma to your body, whether it's C-section or vaginal delivery. And so what I wanted to do is bridge the gap, because if everything's going really well in that first 6 to 8 weeks, it's not really appropriate to see a physical therapist, right? But there's lots of things that you can work on and be able to start reconnecting with your body. And then at the end of that 6 weeks, then I think it's really appropriate to see a pelvic floor therapist just to check, okay, can I really find my muscles? Is there something with the scar tissue that's not healing well or that I can't manage on my own? Is there something in terms of exercise goals that I can't get back to or that I want to do? Can you check me to make sure that I'm ready to do these things? And so this just is kind of the start point, but it just helps to bridge the gap between what we can offer at this point in PT and what women really need, because our postpartum care is just, it's atrocious, and I hate that so much. I think that we should do a much better job of taking care of our new moms, and it's so hard. There's so many expectations and just so many things on them, and so I just want to be another part of that support system and just help to give them what they need and just get what they can out of that first 6 to 8 weeks without really injuring themselves.
I love that. That's just, If you don't know Emily, I think that just goes to show what an amazing person she is, that she's giving these resources out, because there is such a disconnect between our world of fitness, her world of physical therapy, and then the medical world, and where there those 6-week appointments. And lots of times, you know, I've had several clients who have been pregnant, are pregnant, and the doctor is like, okay, 6 weeks, you're good to go. So, you know, they think, okay, if I'm a runner, I'm going to get right back into those high impact exercises. How long does it take your pelvic floor to really heal from birth, would you say?
I would say,
typically?
as always, it depends.
Okay.
Yeah.
Okay.
There is no, just like there's no predicting for delivery or pregnancy or any of those things, like how you're going to respond, there's no predicting postpartum.
Okay.
And so typically that 6-week check is just to check that your uterus is okay.
Okay.
That giant gaping wound in your uterus that was left by the placenta is now healed, right?
Okay.
And it's not that, oh, your musculoskeletal system is ready to go back to all the things you were doing before. It's just, all right, your uterus is healed. Have fun. Good luck. See you later.
Yes.
And, you know, that's not their job, right? That's not your GYN's job to clear your musculoskeletal system. That's our job.
Right.
And so that's where your handy-dandy pelvic floor therapist can be so helpful. It can be 1 to 2 visits, you know?
Yeah.
If you're just like, I don't really know how to find these muscles and I want to reconnect with my core and everything is just so different.
Shifts.
And everything shifts. And so it's a good way to help kind of reconnect with your body, even if it's just 1 or 2 visits. Sometimes it's more, you know, sometimes I see women for 3 months, 6 months, depending on what their goals are. Actually just discharged a patient not too long ago who's about 4 months postpartum, and she's good to go. She's good to run. Her core strategies are good. Things are really, really good from her end. I've also had patients that I've treated for, you know, almost a year, and they're not back to running because their system just isn't ready.
Okay.
And that's not predictable. You know, you may have patients who push for, you know, 6-8 hours, so hard, and they're fine.
Yeah.
Everything's good. And then you have some patients that have like a really quick delivery and things are just not all where they should be. And it can be really hard for them to kind of reconnect. So there's no predicting, oh, I had an easy delivery. Doesn't mean that your body's ready.
That's good to know. Good information, because there is there's a lot of information out there, and I think it can be overwhelming, especially to new moms. So
absolutely.
all this information just kind of helps them have a game plan. And like you said, it's like maintenance. It's maintenance for anything. It's like a regular doctor's visit when we go to get our yearly exams or check your eyes, or the maintenance you do on your car. You have to do that internal maintenance too.
Absolutely.
I'm so glad to talk to you again today.
So fun.
Yes, so we will definitely do this again. If you guys have questions, as always, please let me know. You can, I'll post Emily's information on this video so you can reach out to her or read more about her and what she does. I hope this is beneficial to you guys. I hope you enjoy it, and we will talk again soon. Bye.
Thank you so much, you guys. Bye.
See you later.